Namaskar, I am Dr. Jindal. I had always wanted to bring out this COVID-19 vaccine, talking about the safety, side effects, efficacy, when will it be available, for whom it will be available, will the pandemic be over with this, and all this is very important for all of us. I am a reproductive medicine specialist who also deals with tissue culture, human tissue culture. And since I work a lot with the basic biology, vaccine development has always excited me. And because of this reason, in the last couple of years, there are so many things which have come up, in fact the last year, which I have tried to follow, which I am bringing out to you at this moment, because all of this is very important. My goal is to get you correct medical information, facts, not fiction. And the good news is that vaccine is available around the corner. And the bad news is that COVID is still spreading, deaths are still happening, and a mutant strain has come up in the UK, the future of which we really do not know. One question which I would like to answer, which is always asked, is that how come the vaccine has got developed so fast? Vaccines normally have taken in the past 12 to 24 years to develop, but this particular vaccine has come up extremely fast because of three reasons. Number one, the design of the SARS-CoV virus was with us, the basic architecture was there from the pandemic which was there in 2002 and 2003. And based on this architecture, the basic architecture was known to us. The second thing is a new system of development of vaccines which was never developed before, which was the mRNA vaccines, was developed. And this specifically was good because it was quick, accurate, efficacious, and on the dot. And this new technology has helped for the pandemic situations. And the third important thing is logistically, financially, scientists, developers of the whole world have got together to create this at the earliest. Now, a question which is always asked is, what are the vaccines available and what will be the vaccines available to us? So the vaccines available today in the world which are being given and approved are the Pfizer vaccine, which is being used in the United States, United Kingdom, and Bahrain, and a few other countries have given approval. The Moderna vaccine too has been approved for vaccination, and both of these are mRNA vaccines. Apart from this, for our country, we are banking on the AstraZeneca Oxford vaccine which has been developed and which will be over here produced by Serum Institute in Pune. And the other vaccine which the country is banking on is the ICMR guided Bharat Biotech vaccine, which should be out. This country could also get the Sputnik vaccine from Russia. And of course, the Zydus vaccine, the vaccine which is being developed by biologicals, by Genova, would also be there, but it's going to take some time. Now, what does a vaccine do? A vaccine produces antibodies through something which has been introduced into the cells, which produces an immunological reaction in the body so that antibodies are made, and these antibodies do not allow the virus to propagate in the humans, which means it is something like you have defense guards developed which are going to push out the virus if it enters, or bring it to a position that it can do no harm to you. So these are vaccines. Now, first of all, let me explain to you the kind of vaccines which are there. At the moment, I'll talk about three vaccines. One is the mRNA vaccine. So the DNA strands make something known as mRNA, and this mRNA comes from the nucleus into the cytoplasm, Over here, it produces proteins. These proteins come out of the cell. Once they are out of the cell, they produce a reaction, and this reaction leads to WBC formation, leads to leukocytosis. It leads to a formation where T helper cells are formed, and in turn these cytokines, interleukins, form along with it antibodies. And these antibodies act against if a virus comes. So what the vaccine has is, it has been produced based on the spike proteins, which means the proteins which are there around the virus. So the mRNA vaccine of Pfizer and Moderna was introduced into the cytoplasm, produces proteins which are like the spike proteins of the coronavirus. A reaction already has taken place in the human body and formed antibodies. So whenever the coronavirus wants to enter, it will be pushed out. This is the mRNA vaccine. Now, what is the AstraZeneca vaccine? The AstraZeneca vaccine is a vaccine which has been formed from a rhinovirus of chimpanzees. So they have modified the corona spike protein, put it into the nucleus or the DNA of the rhinovirus, which is a virus which is there in the chimpanzees but does not affect human beings. So this virus goes into the cell, it goes into the nucleus, produces mRNA for the spike protein which comes into the cytoplasm, and this in the cytoplasm further on produces proteins like the spike protein which lead to the immunogenic reaction. So basically, you produce something which will not allow the viruses to infect you. This is what vaccines are. One question which is always asked is, what are the side effects of this vaccine? And because of these side effects, should I take them or not? So whenever a shot is given, the immunogenicity which is developed in the body, it reacts, and whenever antibodies would be formed, there's some sort of a reaction which will happen. And the reaction proves that antibodies are being formed. So in a way you could say, it's good. You normally with all the three vaccines will have some headache, you could have some flushing, some pain, and of course some fatigue or muscle ache. These are the normal side effects which could be there. But most of these side effects are very mild side effects. There are no severe side effects. Until now at least, severe side effects have not been seen. So one thing for all of us to understand is these vaccines are safe, and this is the way forward. So please get a vaccine. This is important because this is important for your life and everybody else's life. So as far as the side effects are concerned, this is the answer. The next question which is asked is, why are there two vaccines, why not one? So all these vaccines are to be given in the form of two vaccines, spaced a few weeks apart, because whenever the first dose is given, which is known as the prime dose, there is an antibody formation which after 2 weeks reaches a level, but it is not the kind of level which we want for protection. And for this the booster dose is given, and whenever the booster dose is given, there is a reaction again to make the antibodies to a level which is the needed level, a high level. So a booster dose would be needed always in all these vaccines. And even after the second vaccine, you can have the same kind of side effects, mild side effects. These mild side effects in all the vaccine trials are a bit more than the common influenza vaccine. A lot of people feel that if they've had a shot of influenza vaccine, they probably have had a mild form of influenza. No, it is the reaction which the body does to give you antibodies. So if you get this reaction, don't bother, the vaccine is doing its job. So please get the vaccination. Do not think that you do not want to take the vaccination because of the side effects, because by your taking the vaccination, you do not only protect yourself, you even protect the spread of this virus. A question which is always asked is, how do you judge the efficacy of the vaccine? So I'll talk about three vaccines which have gone through clinical trials and the data is available: the Pfizer, the Moderna and the AstraZeneca vaccine. So you have a randomized controlled trial in which it is put into two arms. In case it's a trial of 3,000 or 30,000 patients, 15,000 are going to get the vaccine, 15,000 would get something which is known as a placebo, not a vaccine, but in the form of a vaccine. It is going to be judged in both the arms how many people get COVID vaccine or COVID virus infection, and based on the number of people who get the COVID virus, it would be judged how efficacious or safe is the vaccine. Moderna and Pfizer vaccines have been judged about 95% efficacious. The AstraZeneca had two trials, one going on in Brazil. In Brazil, it was found that about 60% efficacy was there. But in UK, something interesting happened, that half the dose was given in the first by mistake or whatever reason, and the full dose was given as the booster. And over there, they found the efficacy much higher. So the combined would come to about 70% for the AstraZeneca vaccine. So the control trials have told us about the efficacy, the safety, the side effects, and of course, the antibodies of how they are formed. I'm going to answer some questions now. The first question which was asked from me is, how important is it to get vaccinated? Well, vaccination makes a difference between life and death. It is safe, effective, prevents you from getting COVID, which has a lot of complication, even long-term complications. And all the recommendations today say and say clearly, for yourself and to prevent the spread to other people, you should get vaccinated. The second question is, does everybody need to be vaccinated? Do children as well as teenagers need to be vaccinated? We understand for sure that a few groups like elderly people with severe diseases are at a higher risk of mortality, and also there is a higher risk for these people to get severe disease. But the recommendation today is that all should be vaccinated, including teenagers and children, because it is safe for them. The only people and the only class of people for which we do not know at the moment whether vaccination is safe or not is pregnant and breastfeeding ladies. And for this we would come to know in time whether it needs to be given. But at the moment, this is the only category where vaccination need not be done. If somebody gets infected with COVID-19, does this person need to be vaccinated? At the moment, the recommendations go ahead and say yes. Though antibodies are formed by COVID-19 infections, but they last not too long. With the vaccination, it is expected that, well, they should last at least a year. And this lasting of antibodies and the higher level of antibodies bring out a recommendation that even if you have had COVID-19, you need to be vaccinated. Another question is, for how long does this last? It is expected to last for a year, but it could last longer. Only time is going to tell us, and further studies will tell us, till what time do the antibodies last. How fast does the vaccine work? And can I go ahead to a stadium for a football match or a movie theater immediately after the vaccine? The answer is, you need to be protective till the time the booster dose has been given and about 1 or 2 weeks have passed, because that is when the immunogenicity would be made. What is the problem in distributing this vaccine? It is a logistic, I couldn't say a nightmare, but a challenging situation where the whole population of this country of ours needs to be vaccinated. There are 3 basic vaccines at the moment I could talk to you about. The Pfizer vaccine and the Moderna vaccine are mRNA vaccines. So they have the mRNA within a lipid bilayer, a nanoparticle bilayer. You could call it butter. So they need to be stored at very low temperatures, because if they are not at those temperatures, they would be denatured. So Pfizer vaccine needs to be stored at minus 70 degrees centigrade, which logistically is very difficult even in the best of countries. The Moderna vaccine, on the other hand, though is an mRNA vaccine, can be stored at minus 20 degrees centigrade, and it remains stable for 30 days at 2 to 8 degrees centigrade, which could be the normal refrigerator. But the best thing about the AstraZeneca vaccine, which is adenovirus vaccine, you could call it a vector vaccine. This is the kind of a vaccine where it was the old method of producing a vaccine. It is slower, but it can be stored at 2 to 8 degrees centigrade for 6 months. From all we know is that the Serum Institute is producing the Oxford AstraZeneca vaccine, which would be distributed to this country. It can be stored at 2 to 8 degrees centigrade. We've had a huge population, and we've had this huge population get the polio vaccine. Probably this would be the way through, but at the moment, AstraZeneca vaccine has not received FDA approval. It has not received approval even in the country like UK. And in India, it is there for approval of emergency. And this country, if it approved, it is approved over here, it would be distributed because at the moment, probably a large stockpile already is there for distribution. The fourth vaccine, which we are talking about, is the ICMR biotech vaccine. This Bharat Biotech vaccine is again manufactured in the traditional process. The phase 3 trial is on, which started, I think, on the 17th of November. So it's going to take some time, probably the end of January or February, to get an approval from the government of India for this to be injected. The next vaccine is the Sputnik vaccine, or the vaccine which is the vaccine of Russia. This vaccine is under a collaboration in our country with Hitro Labs and Dr. Reddy's laboratory. This vaccine, if produced, would also be rolled out after the trials, because the trials need to be completed in our country probably by January end or February. A question: in this country, who will get the vaccine? When will they get the vaccine? How will they get a vaccine? And how will it be procured? Is a question. So in our country, the government of India has decided that the initial vaccination is going to be done for 30 crore people. And this would include 1 crore health workers and doctors, 2 crores frontline workers like police, CRPF, municipal workers, and people who are there at the front. And the rest, 27 crores, is going to be people who are elderly, severely ill, and at a risk of contracting this virus. Now, these 30 crore would be vaccinated, it is estimated, as soon as possible. This vaccination would probably be started by January mid or the end of January. It is going to be distributed through a digital platform, and this platform is also going to have an application by which it will be judged who all have received the vaccine. The government has made a network which will be known as the COVID Vaccine Intelligence Network, or the CoVIN system. This system is going to track the vaccination real time. The registration will be done pre-recorded as per the people who are healthcare workers, frontline workers. There would be no on-the-spot registration, and these vaccines are going to be administered and monitored by this system on a real-time basis. It is estimated that a large population, which I have spoken to you about, would be vaccinated till August. And the rest of the vaccines will be rolled out as soon as possible. Now the question is, who will be the vaccinating people? So this country has a large population of nurses, Anganwadi workers, healthcare workers who went ahead with the polio vaccine program, and this program would be utilized to spread this vaccine across the country. So it's a large logistic job which is planned and will be done by the Government of India. And more importantly, the safety of the vaccination and the efficacy along with the speed is important. If this country gets vaccinated fast, mutation can be controlled. We have recently heard about a mutation in the virus in UK, which is 70% faster in contacting. I'm going to make the next video about it and bring it to you. But at the moment, we are very happy that a vaccine would be there. United States is being vaccinated. UK is being vaccinated. Europe has started. And India will soon start vaccination. Thank you very much for listening through this long video. I had wanted to bring all these things to you. If you like this, please subscribe to my channel, because we're going to come out with 4 more videos on coronavirus, the pandemic. I hope you liked this video. If you liked, please like, subscribe. If you want to ask any question, please put it in the comment section. I hope it's answered a lot of questions. Thank you very much. Love to have you with us.